actually causes water damage in the back of the eye. That is a early sign that you're going to actually have bleeding in your eye, and then you lose vision. When your are healthy, you stand a chance to be healthy. But when your are sick, you don't stand a chance. When you look at the brains of people who are older with cognitive decline or dementia, what you see is that there is less and less blood flow that is normally supplying the brain. It actually goes down. The good news is that you can actually keep your blood vessels healthy, and you can do it with So angiogenesis is a complicated word that's actually quite simple in meaning. Angio, blood vessel, genesis, how our body grows them. So angiogenesis is how our body grows blood vessels. This is your circulation, and your circulation is a 60,000 mile series of conduits. These are the highways and byways in your body that bring the oxygen that you breathe, the nutrients that you eat, and any medications you take to every single organ and every single cell in your body. When your blood vessels are healthy, you stand a chance to be optimally healthy. But when your blood vessels are sick, you don't stand a chance to actually be optimal in your health. So let me tell you why I studied angiogenesis. What drew me to it is because angiogenesis is a common denominator of health, and problems in angiogenesis are a common denominator of disease. Let me explain what that means. When you are growing in your mom's womb, okay, your dad's sperm met your mom's egg, and now you're just a ball of cells, the first organ system that develops in the body, in your little primitive body, is your circulation. Blood vessels form as the first organs. Long before you have a heart, long before you actually have a brain, long before you have an earlobe, your blood vessels are actually forming. In fact, they first start out as blood lakes. So it's just coalescing areas that start to fill with blood. And then they actually start to define themselves and actually become streams, like rivers, streams, trickles, and those are the arteries and capillaries and postcapillary venules that actually form your entire circulation. So by the time you reach 9 months and are ready to come out, your entire vascular system is set into place. And in fact, it's actually set very, very early on. Let me tell you how important blood vessels are during development. Basically, when blood vessels grow, they first grow out, as I mentioned to you, as the first organ system. Then they're followed by nerves. Nerves in your body form tracking right along with the blood vessels. And in fact, every nerve has a blood vessel or two or three supporting the nerve itself, because nerves need blood flow as well in order to function. And then another actually organ system that forms after your blood vessels and nerves is your body fat. Now, this is a really interesting story because body fat in the early days forms right around blood vessels, kind of like a roll of bubble wrap around your blood vessels. Now, you might say, why is body fat forming around your blood vessels? And that is because body fat, fat cells called adipocytes, are actually the fuel tanks, all right? The fuel tanks of your body. So when you eat food, that's your fuel, gets into your bloodstream, and you got to store the fuel someplace. And through angiogenesis and your circulation, your body's able to take that fuel that you eat and store it in the fuel tank, which is your adipocytes or cells in your fat. And that's actually how we store our energy so that we can burn it down and have enough energy to go about our day. So important. And then the blood vessels actually start to feed organs and form right around and into organs like your heart, like your brain. I told you there are 60,000 miles worth of blood vessels in your body. How many miles do you think are in your brain? Turns out the answer is 400 miles of blood vessels are found in the adult brain. Not surprisingly, you need to have a lot of blood flow in the brain. The brain's very metabolically active, so you need good sources of oxygen and lots of nutrients to be able to feed those brain cells so that you can actually be cognitively sharp. In fact, we know problem of blood flow in the brain will cause the brain to spark its own angiogenesis. If you have a stroke, which is a blockage of the brain or an area of the brain that doesn't get blood flow from bleeding or some other problem, immediately your brain tries to grow new blood vessels. It mounts angiogenesis as a healing response to try to create a bypass channel around whatever blockage to bring that brain tissue enough oxygen. Very, very important. And in fact, when you look at the brains of people who are older with cognitive decline or dementia, what you see is that there is less and less blood flow that is normally supplying the brain. It actually goes down. We call this vascular dementia, which is just a description that says that the small blood vessels feeding the brain aren't doing the job that they're normally supposed to do. They're delivering a trickle and not a river of blood flow. All right. That's actually more common than Alzheimer's disease, and something that a lot of people don't know. Okay. The good news is that you can actually keep your blood vessels healthy, what your body tries to do, and you can do it with exercise. Exercise actually helps to keep new blood vessels growing continuously and repairing themselves. You can do it with diet. It turns out that certain foods, like, for example, beets and spinach, will actually help your body produce nitric oxide, which then recruits stem cells that can rebuild and pave over injured blood vessels. So you can repair blood vessels and regenerate blood vessels. And it's really amazing that if you have impaired blood vessels, you can spark new vessels with diet and lifestyle. Now, there are situations where you don't get enough blood vessels from a condition like diabetes. Remember, I told you angiogenesis is important for health, but problems in angiogenesis is really rampant in disease. It's a common denominator of about 70 different diseases. And I just want to talk about diabetes as one of them. The diabetic state, having high blood sugars, all right, and insulin insensitivity. So your blood sugars are around, basically your blood is sweet, right? Lots of sugar, high blood sugars. What it does is that damages the cells lining your blood vessels so they don't actually function quite as well. And they even damage the stem cells that could be trying to repair your blood vessels. This is a serious thing. And that's one of the reasons why people with diabetes, long-standing especially, have problems with their blood vessels. And the body tries to mount angiogenesis, tries to grow new blood vessels to create bypass and adequately feed the tissues. But guess what? Angiogenesis is impaired in diabetes. How do we know this? Well, actually think about it. The complications of diabetes, one of the biggest ones are blood vessels that are growing abnormally in the back of the eye, in the vitreous humor. And that's called diabetic retinopathy, where blood vessels grow. There's not getting enough oxygen because there are problems in the blood vessels. And so the body tries to grow new blood vessels, but the blood vessels are not able to do it properly. Abnormal angiogenesis in the diabetic eye. The blood vessels leak. Now, you don't want to actually have a leak in the back of your eye. That's basically like having a leak from your plumbing under your sink. You flood it with water, and that water actually causes water damage. In the back of the eye, it causes edema called diabetic macular edema. That is an early sign that you're going to actually have bigger problems, including blood vessels growing and bleeding in your eye, and then you lose vision. Okay, so this is the problem of abnormal angiogenesis and diabetes in the eye. Another place we actually see problems of diabetic angiogenic defect is actually in the skin. Now, what am I talking about the skin? Well, if you ever cut yourself, you know that you will bleed very, very rapidly and vigorously, and that's because we've got blood vessels under the skin and then even deeper into the fat tissue, into the muscle, all the way down to the bone. Remember, 60,000 miles of blood vessels. Well, guess what? When you injure yourself, normally your body basically says, well, we got to actually mount an angiogenesis response for wound healing to be able to grow new blood vessels to fill in that spot that was cut open. By the way, you've ever had a scab that fell off too early, right? You skin your knee, a scab forms, and then you're very active, or you're putting clothes on, and maybe the scab drops off prematurely. What's underneath there? It's this bright red bubbling stuff. That is angiogenesis staring you right in the face. That's hundreds, thousands of new blood vessels growing to try to fill up that area in order to heal the wound. The problem in diabetes is that the blood vessels don't grow normally. Remember, I told you in the eye they don't grow normally. Well, in the wound, they don't grow normally, and they actually have difficulty growing. And so you have impaired or problem angiogenesis if you have diabetes for wound healing. It heals very, very slowly. Ask anybody who's diabetic if they cut themselves, maybe cut themselves in the kitchen on a knife or scrape them. It can often take them a long time to heal. Now, this winds up becoming a big problem, and my organization, the Angiogenesis Foundation, has been studying this problem in diabetes in the foot. Now, what's going on there? Well, guess what? Your foot is packed with blood vessels under the skin and deeper, and it's also packed with nerves. But diabetes, actually, because it affects the blood vessels, makes the blood vessels abnormal, Remember I told you nerves need a blood supply? Well, when those blood vessels are sick in diabetes, they can't support the nerves. Now the nerve starts to die, and now you have diabetic neuropathy, and that's partly because of the microvascular small vessel disease. Blood vessels die back, nerves die back. Guess what? Now you don't have proper normal sensation. Now, why is that a problem? Well, it can be a problem in a lot of different organs, but in the foot, it's a particularly a bad problem because if you cut yourself on the bottom of your foot, so think about it, walking barefoot on the ground, on cement, on a beach. Listen, there's a lot of objects there, sharp objects there. Maybe there's a piece of glass or a nail or a stone, a very sharp stone. Normally, if you don't have diabetes, normal sensation, you step on it, ouch. And so you move very, very quickly so you don't actually let it to cut you. And if it did cut you, you'd feel it. It would hurt. And then you look at the bottom of your foot. Not so in diabetes. In diabetes, you don't notice what's actually happening because you don't have feeling, not normal feeling. Diabetic neuropathy due to microvascular disease, which is a problem of angiogenesis, and those wounds don't heal properly. Now, maybe you would notice it if it's on your knee or on your hands. But guess what? On the bottom of your foot, when's the last time you looked at the bottom of your foot? And some people actually, particularly older people, they have problems like lifting their right leg and looking at the bottom of their foot. And people who carrying a lot of extra weight, they might not even be able to see the bottom of their foot. Guess what? That is the beginning of a diabetic foot ulcer, which you can't see it, you can't feel it, but it doesn't heal normally. And now it's on the foot. The foot is on the ground or in a shoe. It's contaminated. You wind up getting infection. If infection isn't even felt because you have neuropathy, often the infection is smelled. You smell something terrible, and then you take a look and you've got a foot ulcer. And this is why people with diabetes really, really need to take good care of their feet and check their feet regularly. Look between the toes. Look on the bottom of your feet. Look around your ankle and your heel. Listen, if you can't see it very well, what I recommend is taking a handheld mirror, putting it on the ground, right? So you're standing or sitting on top of it, and just put it under your foot and just move your foot over it so you can actually see if there's anything underneath your foot. That's a good way to check. Look between your toes, all right? I know it doesn't sound like a normal thing to do, but it can be really, really important because if you wind up getting an infected diabetic wound that's not healing because of a problem of angiogenesis, guess what happens? You get infected, that infection can turn into gangrene. By the time you know it, you've got a deep infection, and that can even lead to limb amputation. Don't want that. By the way, the same kind of problem of blood vessels being sick and not being able to grow properly, it can affect the heart. All right. And that's actually why people with diabetes are at an increased risk for cardiovascular disease, including coronary disease. You see, this is why angiogenesis is so important. It is something that your body needs in order to be able to have normal circulation, normal organ function, but that it is when it doesn't work properly, which is a common denominator in disease. We just talked about diabetes, and we talked a little bit about cognitive decline, dementia, even Alzheimer's disease is a problem with angiogenesis. But look, problems of angiogenesis occur too many or too few, not enough blood vessels or too many blood vessels, a problem in 70 different diseases, including cancer, heart disease, stroke, blindness, arthritis, dementia, as we've mentioned, a large number of conditions, psoriasis, asthma, rheumatoid arthritis, lots and lots of conditions where you actually have problems in angiogenesis. And that's really what got me interested in it. As a scientist, as a physician, I was fascinated by understanding a common denominator of health, as well as problems that would lead to a common denominator in disease. I said to myself, imagine if we could understand this, we might be able to solve not one problem, but we might be able to pull the bow back and send a single arrow through many, many diseases, including 70 diseases. This was a reason that I, with my colleagues, started the Angiogenesis Foundation 30 years ago in 1994. And guess what? This idea of attacking common denominators has generated almost 50 new treatments for different kinds of diseases, different types of cancer, different types of wounds, including diabetic wounds, like I told you, and venous leg ulcers, pressure ulcers, burns. The list is growing. And as a way of actually preventing vision loss, and in some cases, helping to restore some lost vision as well. So this is a really amazing field. Your body knows how to do it. Blood vessels are one of your health defense systems, and you can eat to actually stimulate it. You can give medicines to stimulate it. I'll make a video in the future talking about the amazing medications that actually have been developed that we've been part of in order to be able to actually get new blood vessels to grow. So look, if you want to learn more, please subscribe to the Angiogenesis Foundation's YouTube channel. Hit like, be a subscriber, and you're going to hear about new, important, and very interesting things from me, from other people that we'll have on YouTube, and of course, from our new mascot, Dr. Angio. So with that, Dr. Lee out.